Hey green belts, now it's time to open up the posterior chain. Okay, so remember what we're going to do is we're going to work a system called MSA. The M is myofascial release, foam roller, ball, something to dig into that tissue, get it warmed up. S is the stretch. So now you're done digging that thing around. Now we want to elongate that tissue, kind of clean it out a little bit. Once you're done with all the hard work, the A is activation. That's our whole goal. If you skip the A, the activation part, you've done all that hard work for nothing. It's a window to improve your mobility to then now open up that area that's weak. Okay, so first we're going to do the M part. We have Haley here on a foam roller. What we're going to do first is do the spine. So just put it between your shoulder blades. You can pick the butt up, kind of mobilize that spine. Okay, we've already kind of talked about this before in the white belt series, but you're just trying to warm up to get that spine to flex and extend a little bit. So like I said before, everyone's kind of typically hunched over, has an increased kyphotic curve, so the rolled shoulder, mid-back. We want to get that extension through here. Remember to work on your breathing too. If you come up, you breathe out. You open up, you breathe in. Okay? Then now what you're going to do is you're going to sit on it. We're wanting to work the hips. So remember on this one, cross the leg. Whatever leg you cross, that's the hip or side or glute you're going to work on. Okay? Now remember the foam rolling part is just the scan. You're trying to scan that tissue to find that trigger point and stop. And like Haley's doing, she's moving that knee up and down, trying to dig that knot out of there. Okay? Then the next side, of course, do the other side, but we're going to skip that part. Now we're going to do just a little bit on the hamstrings, just a little bit. Now personally, I'm going to show you how to, well, Haley's going to show you how to do this on a foam roller. Honestly, I don't really like it on the foam roller. I actually like to use a ball because it's a pretty deep muscle. It's hard to get that tissue to really open up with the foam roller. But she's going to show you real quick. Just put it in the back of the legs. And then you're just going to kind of pick yourself up and roll back and forth in the hamstring. Not rocket science. Now for those who do this and don't really feel anything, I'm going to show you an alternative. Take a foam roll, a yoga block, just to give it some height, and take a little ball. Okay, this is called an acouple ball. This thing's about 3.5 inches. All you're going to do is you're going to set it on top, just so it has some height to it. So Haley's going to put this underneath the hamstring. You're not really going to roll around too much on this. You're going to roll it till you find that spot, and then just kind of sit there. If you can deal with it, and you have enough arm strength, you can put your other leg on top of it just to add more weight. But it digs pretty deep in there, okay? And it's kind of hard to roll around, so just find that trigger point. Now, back to the foam roller. We're going to continue with that posterior chain. We're going to work your calves, gastroc, Achilles area, etc. So right now, Haley went ahead and did the hard one. Okay, now if it's too much for you and you just don't have the arm strength to do it, she's going to bend the knee, kind of put it on the side of the foam roller, and just do one leg at a time. Okay. Now, say you get to a spot, you're like, ooh, that one's tender. What you're going to do is you're going to gas pedal. Sit there, move that tissue around. Now also don't forget to kind of bring the leg in and roll, kind of get that inside part of the calf, and of course the outside. Now if you have a spot you're like, ooh, I really want to sit there and work on it, if you find that knot, you put the other leg on top of it, kind of like she did before, and then you can really feel that area. Now there again, if you want to torture yourself, get the little yoga block and the ball. You will really dig into that area. Okay? Now, that's for the posterior chain. Now we're going to kind of tackle the hip flexors with this also, mainly just the quads. So what I'm going to have Haley do is go face down, and then just put it on, you're going to put it on your thigh. You're just going to roll that thigh. If you find that little knot, flex and extend that knee, sit there and kind of dig that knot. It's typically right in the middle part of the thigh, especially if you're doing a lot of squats. And honestly, a lot of sitting sometimes, you want to kind of work a little bit higher up into the thigh area. Okay, so that is the myofascial release part of it, the M. Now it's time to do the stretching part. You will really dig into that area. Okay? Now, that's for the posterior chain. Now we're going to kind of tackle the hip flexors with this also, mainly just the quads. So what I'm going to have Haley do is go face down, and then just put it on, you're going to put it on your thigh. And there again, like we did again in the white belt video, you're just going to roll that thigh. If you find that little knot, flex and extend that knee, sit there and kind of dig that knot. It's typically right in the middle part of the thigh. Now I want you to take that ball and we're going to work that front hip. So everyone always wants to know, like, where do I start with? So right when you bend the knee, That's where the hip joint is at. We're gonna start there. We're gonna do some more capsule work. Put this nice heavy ball right there, and then we're just gonna slowly work all the way around. So Haley's already in position, and what she's gonna do is just, you'll go up and down, and you should feel a little groove it's in. You will find it, because typically it's pretty tender. And what you're gonna do is just sit right there, and I'll just roll side to side, just kind of rock it back and forth. What she's gonna do is slowly work her way around to the side of the hip. Kind of like where the IT band, TFL, that muscle for the hip that goes down the leg attaches. If you're a runner, sometimes this will be pretty darn tight on you. There again, if it hurts and you roll around, you find that spot, stop, breathe, embrace the suck, do your thing, okay? Because it will slowly work itself out. But at first, this is gonna be nice and tender. So see how Haley's just slowly working around posterior part of that hip. Now once you get about right where she's at now, it's typically right in the upper part of that glute, where that hip joint is. You'll have your piriformis there, your upper glute. Typically it gets pretty gnarly and locked up. You might have to work on this area a little bit. Now if this is too much, she has her knee bent like this, feel like it's digging way too far, use your legs to kind of pick your butt up so it's just kind of working it lightly. Once you get better, then that's when you just sit there and let all the weight happen there, or you can cross the legs. So there you go. And now it kind of digs even further. Enjoy this one. So next what we're gonna do is the S, the stretching part. Now, what we're gonna do is you attach a pretty thick band to something that's not going to move. Either a pole or a deadbolt door or something, okay? And we have the circular bands here. Haley put her leg through it, kind of put it right around the butt cheek area, and you're gonna take that leg that you put in the band on the ground. And you're gonna go into a lunge position. Okay, what you're gonna do first is you're gonna sit up nice and tall. I actually want you to kind of posterior pelvic tilt, so squeeze that glute if you can, and then you're actually going to flex your core. So the job of the hip flexor is, number one, is to flex the hip. Number two is to extend the lumbar spine or the lower back. So we don't want to arch the back. We want to do the complete opposite. We want to extend the hip and also flex the lumbar spine. So I always tell people, just kind of do like a mini crunch and hold it. Then I want you to let the band do its job and bring that hip flexor forward. Now, if you want a deeper stretch, then what you do is with the same leg you're stretching, take that arm and reach to the ceiling. Perfect, nice and tall. Squeeze that glute, try not to arch the back. And then what you're also going to do is lean the opposite direction. Good. Nice deep breaths. Typically about 3 deep breaths, you're pretty good with this one. Now what we're going to do is we're going to do a pretzel type position. We're going to add the thoracic spine into this. So with that same area, what I like to do is kind of Haley did is she grabbed the band to kind of steady her. And you're going to grab that hand to the foot, and then she's going to move this hand to kind of grab the thigh, and she's going to try to rotate her mid-back, but try to squeeze the glute and try not to arch the back. This is a huge stretch. Try to breathe this bad boy out, okay? Next is we're going to transition to an external rotation of the hip. So with the leg that's down, with the leg that's kind of holding you up, you're gonna swing that behind the other leg. Good. This is like a yoga pose for pigeon. All you're going to do is cross the leg. What I like to try to do is sit there and work on this position first. You're trying to let the band really pull that and gap the joint here. But what I want you to do is try to slowly work that lower leg up as much as you can. Sometimes I'll sit there and just hold it down if I can. Breathe. This is a big stretch for a lot of people. Now once you get better, you're going to put that left elbow on the ground and you're going to reach that right arm to the ceiling. Perfect. That way you're getting that thoracic spine rotation too. Because remember, in your core, it's a big X. This shoulder is going to deal a lot with this hip. And then when you look at the front, this hip is going to cross and go to this shoulder. So the more you can kind of stretch shoulder and hip, opposite arm, opposite leg, the better. Okay? Then what you're going to do now is you're going to go back into an all fours type position. Good. We're going to do an internal rotation stretch. Okay? Now what you're going to do for this is you're going to try to bring the foot out. Good. And sometimes this one's not that big of a stretch. You won't feel it like you will the other ones. So you might have to go away from where the band is attaching just a little bit. like actually move your whole body that way. There you go. And then what I'm gonna have you do is keep the knee drilled into the ground and then let it pull you this way toward the wall. This way. Perfect. Now, once you're kind of here, keep this leg fixed. And you're just gonna slowly go toward this way to cause more internal rotation at the hip. Okay, so if you feel the pinching type pain, especially at the bottom end of a squat, and impingement, a lot of times your internal rotation is shot. Okay, so definitely try this one out. Now, to kind of keep with the hip, you're going to stand up and we're going to work on a hip flexor type position. So Haley's going to face away from the wall. She's going to straighten the leg that's in the band. This one is going to be her right leg. Bend the left one, and then all you're going to do is bend to try to touch the toes. Good. I always like to try to touch the outside toe that is straight. Good. Let the band pull you back. Don't fight against it. This should be a huge hip flexor stretch. Now once you're here, what I want you to do is same thing. Open up that thoracic spine. This is kind of like another yoga move. Let that hip get pulled back. Do about 3 nice deep breaths. Okay, now for the activation part. Now, a lot of times people have a lack of pelvic stability, and so when they do their toe touch or their leg raise, they can't really achieve the range of motion they want, either because the tissue is tight, we've already worked on that, or the pelvis just doesn't have the stability there, so it's kind of like tilted forward, and then it's kind of pulling on the hamstring, so the range of motion is already going to be limited because the where it's attaching is moved further away. So we want to control what our lumbar spine and pelvis is doing. So we're going to assist this. So we have something attached to something that's not going to move. We have Haley grabbing it and she's going to pull it down just a little bit. It's just here to activate the core. So when she raises her leg, her back doesn't move up and down. So now we're going to have Haley raise one leg up and lower it down, nice and slow. The whole thing is she should not have any back arching or any type of spinal movement because she's working hard to activate this core. And breathe behind the shield. So this is hard right here and she still has to breathe. If not, she'll pass out while she's here, okay? Now, this is nice and challenging, which is great. If you feel, especially at the lower part, that your pelvis is coming up or it's kind of popping or doing something weird in this pelvic area, either don't go down as far or really, really work hard at breaking posture and position here. So now we got the banded cat-cow, which we already done before, but a lot of times if people can't touch their toes because their lumbar spine is actually extending when all the rest of you's flexing, this is a problem. So if you can't do the toe touch, we're going to isolate this lumbar spine. Now I personally love doing it just to kind of get that back to move, but what we're going to do here is we're going to review it again. So Haley's going to put it around her wrist. Now remember, don't put it on your thumb because you'll pull your thumb out. So make sure it kind of goes flat across the palm. She has it right here in the lower back. Same thing. Breathe out, go up, tuck the pelvis. Then as she breathes in, she's going to look up and then kind of let the back move. Do it again. Good. Do about 3 to 5 times. Depends on how tight you are. Now, if you can feel, man, my lower back is jacked up, you should do it more and concentrate on the breathing. So the next is going to be a toe touch. Some of you can't even touch your toes, so we need to fix that and clean that movement out, okay? Now, Haley's very mobile, so this will make it look very easy, but honestly, it's not for some of you guys, okay? So what you'll need is something that's going to be about a few inches off the ground to about 1 foot long. So sometimes I just have people cut a 2x4 that length. Then you're going to need something soft. Just this is a rolled up towel. You can use a pillow, a small pillow, something, okay? So what you're gonna do is you're gonna put that soft thing between the knees. And what you're gonna do is you're gonna put the balls of your feet on the thing that's 2 inches off the ground. Feet are always going to be together. What Haley's gonna do is bend over, try to touch the toes. Remember, breathe out. Then I always like to have you take a nice deep breath while you're down there. Squeeze that pillow, towel, whatever, relax. Then come all the way back up. Hands over your head. Good. Breathe in. Then you breathe out. Bend, touch the toes. Good. Squeeze. Relax. Come back up. Always over the head. Good. Now, Haley's going to continue doing that. Now, for those that cannot touch their toes, they're stopping. I actually want you to bend the knees to touch the toes and then come back up. We want to kind of trick the brain, hey, you can touch your toes. Okay? So sometimes this is just a brain training type movement. Now after you've done 3 to 5 reps with your toes on it, you're going to step forward and you're going to just have your heels raised up. Okay, same thing, feet together, same process happens. You bend, try to touch the toes, breathe out. When you get to the bottom, squeeze the knees together, then relax, come back up, breathe in. So this is causing a different weight distribution to make your hips set back a little bit further. Because a lot of people, they might have the spinal mobility to do it, but their hip mobility is awful, or they just don't know how to use their hips. So this is the same thing, 3 to 5 breaths, okay, or cycles. Now once you're done with this one, I want you to try to step forward. Do it on a flat ground, okay. Same process happens. Bend, touch the toes. Good, squeeze. Relax, good. So this will take a little bit, but this is a great way to help improve your toe touch pattern, or if that posterior chain is nice and tight, this just helps clean everything out. And this is what I have a lot of my patients do before they do deadlifts and they can't touch the floor. Okay? Because honestly, you shouldn't be picking things up from the floor if you can't touch the floor, because your movement pattern's gonna be crap. Okay? Have fun.